Here we have some big news coming in. India's Omicron tally has surged. India's Omicron tally crosses the 1,500 mark. Over 100 new Omicron cases in just the last 24 hours reported. Maharashtra continues to top the list with most Omicron cases. 460 Omicron cases reported in Maharashtra. Delhi at the second with 351 Omicron cases. Gujarat now at the third highest Omicron cases with 136 reported, followed by Tamil Nadu. Here are the 4 states that we're looking at a surge in the Omicron cases. India's total Omicron tally has now surged beyond 1,500. Milan Sharma reporting live from Delhi. Milan, do take us through exactly the worry here. We are looking at the Omicron tally that's gone well beyond 1,500 mark, and that's of course raising concerns considering the overall case count in India with regards to COVID-19 has surpassed 22,000. The Omicron variant seems to be fast spreading.
Yes, definitely. And this is the concern that experts have now called out. The way the cases are increasing across India at the moment, and also the Omicron cases that have seen a surge. We are looking at the beginning of the third wave already. Many experts have already said this, and they've also said that somewhere the cases of Omicron are not showing contacts that were traced to international travel. So community spread at some moment has also begun. The surge in cases is largely being led by the Omicron variant. As in the case of Delhi, it's been said that more than 50% of the caseload is now due to Omicron, and that is something that is worrying because the variant is very infectious, which is why people have been told to mask up. But mask compliance seems to have gone low, especially after a lot of people celebrated the New Year's, went to parties, and did not really do masking in tourist areas as well. And that surge is now going to be seen in various cities going forward.
Milan, stay with us. I'm going to quickly cut across to Pankaj Upadhyay joining us from Mumbai. Mumbai has also seen a rise in COVID-19 cases, the Omicron variant being the dominant one. Pankaj, despite COVID curbs in place in Mumbai, we see cases only on the rise.
Yes, Nabila, and in fact, some of the experts say that Omicron is in community outbreak phase already. And a recent report said that 45% of the 450 Omicron cases have no international travel history at all. That is, out of 450, around 206 have had no international travel history as well. That raises a lot of concern. And if you were to look at the tally in the state, currently we have 460 cases, but out of these 460, 327 are from Mumbai itself, 28 from Pimpri-Chinchwad, 21 from Pune Rural, 13 Pune Municipal Corporation, and 12 from Thane Municipal Corporation. So you see, Nabila, Mumbai is worse affected here. And that is the reason why all the districts have been said that they need to upgrade their existing infrastructure, and a deadline has been set. The deadline is of 15th of January. Yesterday, Chief Minister of Maharashtra, Uddhav Thackeray, said that the state is capable enough of handling the current COVID crisis, and that if the need be in the days to come, he is going to address the state as well. But he said he needs the cooperation of the Aam Janta. On the other hand, we have the Deputy Chief Minister of Maharashtra, Ajit Pawar, who clearly said that if cases continue to rise, then the government will have no option but to increase the various restrictions. But as you rightly pointed out, in spite of the various guidelines and restrictions that have been rolled out by the state, cases continue to rise. And
well, that's highly unfortunate. It's about time that the citizens take responsibility for this, because unless you are away from large gatherings or crowds, even small gatherings for that matter, is susceptible for an infection spread. Pramod Madhav also joining us from Chennai. Tamil Nadu, also one of the worst affected states. Pramod, we know that there are strict curbs put in by the Tamil Nadu government there for the state, but yet it doesn't appear that the case load is decreasing. We're seeing a rise in numbers. What do you think is the matter?
Well, the situation is definitely a little bit grim, actually, since the last week. Until Wednesday, the cases registered were 600 plus per day, but currently it has crossed 1,400 plus mark. And not just that, in the state of Tamil Nadu, the actual Omicron cases number has gone up to 120. In fact, until Thursday, it was 46. But on Saturday, the health minister has informed that the case has increased to another 76. And the worrisome part here is that from one NEET coaching center, 34 people would have tested positive, that too for the Omicron variant. The health minister is requesting public to maintain social distancing. And in fact, here we are showing one of the mega vaccine centers that has been conducted in this city of Chennai. This is across Tamil Nadu. This is the 17th mega vaccine. And the health minister is very clearly mentioning that there are chances, like various officials are also claiming that there are chances that it is turning out into a community transfer. And that's the reason they are requesting the public to get vaccinated as soon as possible, and not just that, maintain social distancing. Yes, the Chief Minister has brought in new curbs as well, but at the same time, the situation here definitely is a little bit grim as the number of positivity cases per day has increased within, within 3-4 days from 600 plus to 1,400 plus in the state of Tamil Nadu.
Well, thank you very much, Pramod. You stay safe. I'd request our reporters on ground to stay safe, mask up. We're seeing a rise in COVID cases across states. Milan bringing us more from Delhi. Pankaj Upadhyay and Pramod Madhav. We're going to continue tracking those developments. Now, amid the rising Omicron cases, the centre has meanwhile asked states to take double precaution, to be prepared for the worst. In fact, the Union Health Ministry has written to states, warning them that they might start seeing a stressed healthcare infrastructure once again in the coming days. The government has also asked states to activate district-level surveillance. Amid the rising number of COVID cases, various states have imposed COVID restrictions. This includes night curfew and a ban on social gatherings. India records 27,553 fresh COVID-19 cases, with Maharashtra recording a maximum of 9,170. Omicron case tally has now risen to 1,525 in Maharashtra, which tops the dubious chart, with over 460 infections, followed by Delhi and then Gujarat. Well, we're looking at Omicron variant being the dominant variant here. Caseload has only increased. In fact, close to about 2 lakh cases of Omicron variant itself has been detected in the United Kingdom. But so far, there hasn't been severe symptoms. The reports are that the variant is super infectious, but as per the symptoms, it's been mild. But nonetheless, we still have those with comorbidities at high risk. In fact, one death was reported from the Omicron variant in Australia, as well as in the United Kingdom. 2 deaths were reported in the recent past. So one can't be so sure that this variant is not as severe. It could very well be severe to a comorbid patient, and that's the worry here, and that's what needs to be kept in check. Now, in the meanwhile, I'm going to take you through the centre's advisory to the states with regards to healthcare infrastructure. Let me take you through the details that have been given out, an advisory as such. The centre has advised states on the health infrastructure that may just come under stress, considering there's a rise in COVID-19 cases. We don't want to be repeating what we saw in the second wave. The centre has asked states to be ready for rising COVID-19 caseload. Remember, we're looking at over 22,700 cases of COVID-19 that's been reported in India, active cases as of today. We're looking at the centre advising states to build makeshift hospitals at the field level. In fact, a lot of makeshift hospitals have already been laid out in many states, but it's now about time that they are active. In case of an emergency, the centre has asked states to activate district-level COVID surveillance as well, which is absolutely important at this point of time. Contact tracing is, of course, as important as testing at this point. Let me quickly cut across to big news coming in from Maharashtra. We're looking at close to 10 ministers and 20 MLAs in Maharashtra who've tested positive for COVID-19 after attending weddings, is what we hear. Maharashtra Deputy Chief Minister Ajit Pawar has said that stricter curbs are likely to be imposed if at all the caseload rises more than what it has. Now, the question here is, several VVIP weddings is now becoming the super spreader. Is this what we're seeing in Maharashtra? VVIP weddings there causing a spike in COVID-19 cases. Let's take a look at this report to give you some details.
Maharashtra continues to battle a COVID surge. From citizens to Bollywood celebrities, the contagious virus hasn't spared anyone. But now even netas are in the grip of COVID. 10 Agadi ministers and 20 MLAs have tested positive.
कोरोना खूप झपाट्याने वाढतो. मी मागेही काहींशी आपल्याशी बोललो होतो. 5 दिवसच अधिवेशन आम्ही ठेवलेलं होतं. तरी 5 दिवसामध्ये जवळपास आतापर्यंत 10 मंत्र्यांना कोरोनाची लागण झालेली आहे. जवळपास 20 पेक्षा जास्त आमदारांना कोरोनाची लागण झालेली आहे. प्रत्येकाने लोकप्रतिनिधी असेल किंवा कुणी नागरिक असेल.
Pawar's revelation comes days after Maharashtra's Women and Child Development Minister Yashomati Thakur tested positive. With no large gatherings and parties allowed, the Maharashtra government said it would have to bring in restrictions if the surge continues. This comes at a time when pictures of prominent politicians attending extravagant weddings went viral. From the wedding of Maharashtra Minister Jayant Patil's son, BJP leader Harshvardhan Patil's daughter's marriage to Bal Thackeray's grandson, or the sons of Sena MLC Ravindra Phatak and Sena MLA Uday Singh Raj and the son of former BJP MLA Shivaji Rao Kardile. Earlier in November, a video of Supriya Sule dancing with Sena MP Sanjay Raut at his daughter's wedding also emerged. Agadi leaders have defended these super spreader events.
आणि लग्नांचे विषय आहेत. हळूहळू त्यातून मार्ग निघेल, कारण ही लग्न आधीच ठरलेली होती. मुहूर्त आधीच ठरलेले होते. तरी लोकांनी अनेक बंधनं पाळली. मी गेल्या काही दिवसापासून पाहतो.
Is a COVID spike among Agadi netas due to complacency? Bureau Report, India Today.
Now, registrations for teenage vaccination has kick-started on Saturday amid the surge in COVID and Omicron cases across India. Both walk-in and online registration via the CoWIN portal has been initiated for 15 to 18-year-olds. After getting the vaccine, children will receive their vaccination certificate on the Arogya Setu app. They can also download it from the CoWIN portal. 15 to 18-year-olds will be given Bharat Biotech's Covaxin shots. Separate vaccine centers have also been set up in hospitals across states. While vaccines at government hospitals in the national capital will be free of cost, a single dose of Covaxin will cost 1,250 rupees in a private hospital. Children will get their first COVID jab on January 3rd, and registrations for which on CoWIN portal has already opened up on the 1st of January itself. Vaccines will be rolled out on the 3rd.
Kids are the most vulnerable at this point in time. So that's the responsibility of all the parents, and thanks to the government that they have really taken up this. And I'm really, hopefully today I will get the registration done and get over with. It's a responsibility as a parent and also as a citizen that we must get as many people vaccinated. I have a daughter who's 12 years old, so she's the next in the line.
हमें पूरा यकीन है कि ये वैक्सीनेशन बच्चों के लिए भी उतना ही सेफ होगा जैसे एडल्ट्स के लिए था. जो भी ट्रायल्स हुए हैं बच्चों पे इस वैक्सीन को लेके, अभी तक उसमें से ऐसी कोई भी डेटा नहीं आया है जो सजेस्ट करे कि कोई सीरियस साइड इफेक्ट्स होगा. तो जैसे एडल्ट्स को या किसी भी वैक्सीनेशन से थोड़ा बुखार, थोड़ा हाथ में दर्द हो सकता है, वो साइड इफेक्ट्स ज़रूर हो सकते हैं बच्चों में, बट उसके अलावा ऐसा नहीं लगता कि और कोई सीरियस साइड इफेक्ट्स होने के चांस है.
The COVID-19 numbers are surging in the national capital as well as across the country, but the only sug of relief right now is that the registration process for the vaccination of teenagers between 15 to 18 has started from today. Union Health Minister Mansukh Mandavia appealed the
All right, here we're looking at a vaccination drive for teenagers that will begin on the 3rd of January. Registrations have already begun. If you have children of that age bracket at home, then you can certainly help them register on the CoWIN portal. Remember, it's easy for children to do it themselves. And if they do not have an Aadhaar card, then a family member's ID or even a school ID or a college ID will work. All right, we are looking at some fresh curbs reported now in Haryana. According to Haryana Health Minister Anil Vij, curbs in districts with high daily cases: Gurugram, Faridabad, Ambala, Panchkula and Sonipat. These are the districts there that have curbs in place. Additionally, now malls, markets to close by 5 p.m. Only fully vaccinated people will be allowed to enter public transport. Hotels, restaurants, malls, grain markets, all of these areas will demand a vaccine certificate if you really want to venture into it. In fact, the teams there on ground have formed for enforcement of law. This is almost mandatory now. If you've got to enter any kind of market area or mall for that matter, you've got to show your vaccine certificate. Here we're looking at fresh curbs reported in Haryana, and according to Haryana Health Minister Anil Vij, the curbs in districts will begin, especially those with high caseload, including Gurugram, Faridabad, Ambala, Panchkula and Sonipat. Malls and markets to close by 5 p.m. itself. Fully vaccinated only will be allowed to enter public transport, hotels, restaurants, malls and grain markets.
नई पाबंदियां लगाई हैं, जिलों को दो हिस्सों में बांट दिया। जिनमें ज़्यादा संक्रमण है उनको एक कैटेगरी में रखा है, उसमें गुड़गांव, फरीदाबाद, सोनीपत, अंबाला, पंचकुला है। इनमें ज़्यादा सख्तियां लगाई गई हैं।
Well, there you have it. Haryana has now placed fresh restrictions. We're looking at Gurugram as one of them. Gurugram, Faridabad, Sonipat, which will have fresh curbs in place. 5 p.m. itself, malls and markets will shut. And apart from that, if you want to enter public transport or malls, etc., you will not be allowed without a vaccine certificate. I'm going to continue tracking those developments. We're going to take a short break for now. We'll be right back. Stay tuned. All right, here's some big news that we are currently tracking. Ahead of the Supreme Court hearing in the NEET postgraduate admissions, the case to be held on 6th of January, it will be heard. The centre has filed an affidavit stating that there will be no change in existing criteria for reservations. The centre in its affidavit has said that 8 lakh rupees annual income criterion for economically weaker section reservation will remain. Remember, the resident doctors across the country have been protesting against the delay in finalising postgraduate admission process after the Supreme Court put out a stay on admission process. Let me cut across to Anisha Mathur joining us for more on that. Anisha, take us through exactly what's the demand put forth by students, resident doctors who are protesting, and what has now the central government said.
Well, Nabila, if you look at the entire conflict, this entire case and the entire dispute, the issue has been that petitions were filed in the Supreme Court challenging the 2019 criteria, the reservation policy that was put out, where an existing criteria of 8 lakh rupees as a cutoff for EWS admissions was given. Now, the court had asked, what is the sanctity of the criteria? Why have you put this particular criteria? What about the various issues with regard to these criteria? And in this affidavit and in this report that was filed by the centre late last night, what the centre has now done is justified its decision to have the 8 lakh rupee criteria. They have also said that for now, this 8 lakh rupee criteria annual income limit to be considered an EWS category will continue. But for next year's admissions, the revised criteria could come into play, where residential assets will not be counted. Families which own agricultural land of over 5 acres will not be counted as EWS irrespective of actual income. These were certain issues that had been flagged in the petition before the court, which said that even though the criteria is for economically weaker sections, it is people from slightly higher income categories who have assets, who have land, they are getting the benefit of this particular reservation policy, which is why the court had said that you put a hold on the admission process till we look into this issue, till you can justify why you got this particular income criteria. Now, the centre in its affidavit has given the detailed report that was filed by the central government committee, where They have said that they've looked into all the reasons why this criteria was created, and they've looked into the revisions that are needed. But for now, the admission process and the examinations are already ongoing. The process has begun. Therefore, for this year at least, the center has said that no change in the criteria should be done. The recommendations of the committee would be applied prospectively. Back to you.
Anisha, thank you very much for joining us with those details. That's the update here. Supreme Court all set to hear the matter on the 6th of Jan.
Co-presented by Berger Paints. Paint your imagination.
Now, a mega Vikas push in pole-bound Uttar Pradesh. Prime Minister Narendra Modi will be laying the foundation stone of a sports university named after hockey legend Major Dhyan Chand. The university will be built at an estimated cost of 700 crore rupees in Meerut and will have all modern sporting infrastructure. According to the government, the university will be housing facilities for shooting, squash, gymnastics, among others. Major Dhyan Chand University will have a capacity of training at least 1,080 sportspersons. Prime Minister Modi will also be interacting with 32 national and international players from Western UP. Prime Minister Modi will also be paying tributes there to martyrs at Amar Jawan Jyoti, a memorial constructed after the Indo-Pak War of 1971 to commemorate the soldiers of the Indian Armed Forces.
फुल प्रूफ जो भी मानक है उसके अनुसार सुरक्षा व्यवस्था की गई है और इसके अलावा विशेष ध्यान ट्रैफिक पे है। हम लोगों ने डाइवर्जन प्लान बनाया है, उसको कल पब्लिश भी किया था। जहाँ जिसके लिए कुल यहाँ पे 9 पार्किंग है और सभी के लिए निर्धारित की गई है किस पार्किंग पे किसको आना है, तो उसके मुताबिक लोग आएंगे। फ्लैक्सी भी लगवा रहे हैं बीच में, हमें कहाँ से मुड़ना है, कहाँ करना है।
16,000 से ज़्यादा खिलाड़ी हमारे पूरे प्रदेश से आ रहे हैं। ये अलग अलग स्पोर्ट्स के हैं। साथ ही माननीय प्रधानमंत्री जी से 32 ऐसे खिलाड़ी हैं जिन्होंने ओलंपिक, पैरा ओलंपिक और अभी नेशनल लेवल का जो हॉकी टूर्नामेंट था उसमें प्रतिभाग किया था, गोल्ड मेडल जीता था, उनसे मुलाकात है। साथ ही जो मेरठ और मुजफ्फरनगर के हमारे ओलंपियन हैं उनके परिवार वालों के साथ भी माननीय प्रधानमंत्री जी मुलाकात करेंगे।
All right, let me quickly cut across to Shreya Chatterjee reporting from Meerut. Shreya, give us an insight into the sporting infrastructure, a massive one coming up in Meerut. What's to look forward to?
Well, you know, if I could just give you an understanding about the enormity of this university, then you can understand this entire ground, because this is the place where the sports university will be coming up. This is Salawa in Meerut, where today the Prime Minister will be laying that foundation stone for the Major Dhyan Chand Sports University. It is going to be one of the kind of the state-of-art facility where there will be facilities provided for all kind of sports, which also includes squash, long tennis, and a velodrome of cycling will also be present, is what we are learning so far. Now, if I could just quickly update about what the Prime Minister's schedule in Meerut will be, he will be coming at around 11:30 p.m. and then he will be going to Amar Jyoti Jawan. Followed by that, there is a temple visit, and then around 1:30 he will be coming over here in Salawa, where he will be laying that foundation stone for the Major Dhyan Chand University. And you can see behind me, the crowd has already started coming in, and the excitement is clearly there so far as this particular university is concerned.
Thank you very much, Shreya, for joining us with those details.